Exposure to hazardous biological material represents one of the most sensitive scenarios in clinical practice, as it involves the potential transmission of serious pathogens such as HIV, HBV, or HCV. Accidental needle sticks, splashes on mucous membranes, or direct contact with contaminated fluids require an immediate response, where prompt action and a deep understanding of protocols make the difference between a safe intervention and the development of long-term complications. Specialization in this field allows professionals to master immediate post-exposure measures, the interpretation of analytical tests, and the application of post-exposure prophylaxis guidelines. This ensures not only individual protection, but also the preservation of collective safety within healthcare teams. Understanding the importance of immunization, clinical follow-up, and proper use of protective barriers becomes an essential pillar in guaranteeing a reliable and rigorous care environment. Thus, training in this area is consolidated as an example of academic and scientific excellence, integrating high-level protocols with a practical and preventive approach. The ability to act precisely in situations of biological risk grants the specialist a leadership role in emergency medicine, where innovation, prestige, and professional responsibility come together to safeguard both worker and patient health.